Welcome to the 262nd of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I'm very glad to talk with sociologist Deborah Carr about older adults and the stress of COVID-19. Just a reminder, you can catch COVID Calls live most weekdays at 5:30 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can hear COVID Calls anytime recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and future topics. And please feel free to suggest yourself as a future guest. As of today, April 20th, 2021, there are 3,035,771 deaths globally from COVID-19. That's according to the Johns Hopkins University Coronavirus Resource Center. The death toll in the United States from COVID-19 has now reached 568,277. In Canada, 23,707 people have lost their lives to COVID-19. In Mexico, 32,003 people have died from COVID-19. I'm also noting here, in case you haven't heard, and also for the archival record of COVID calls, that police officer Derek Chauvin was found guilty today, in fact, just a few moments ago, of the 2020 murder of George Floyd in Minneapolis. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way, and I'd like to continue that reading now. The headline is "From Starvation to Overdose, Coronavirus's Hidden Toll Emerges in Colorado's Death Data." This is by John Daly. And the story appeared February 16th, 2021 in Colorado Public Radio News. In 2020, COVID-19 ravaged the state's nursing homes, forcing an end to visitation by family and friends and lockdowns of residents. That in turn appears to have contributed to a hidden toll from the disease for some Colorado seniors: starvation. As many as 100 more seniors than expected, most of them in nursing homes, essentially stopped eating in 2020 and died of what is clinically termed nutritional deficiencies on state death certificates. COVID-19 has now officially claimed more than 6,000 lives in Colorado, but as state health officials finish compiling records from the deadliest year in state history, hundreds of additional deaths, which appear to have at least an arm's length connection to the pandemic, are becoming apparent. They include those 100 out of 347 people who died last year of starvation, and at least some of those who died of parasitic diseases, drug overdoses, Alzheimer's, and liver disease too. All those causes of death experienced double-digit percentage increases in 2020 in Colorado. That's above the average number of deaths from the causes in the 3 years prior to the start of the pandemic. They are all part of 8,222 excess deaths, so-called, in 2020, above the average for the 3 previous years. Early on in the pandemic, we were calling this COVID collateral damage, said Dr. Kyle Legat, a family medicine physician in Lone Tree, Colorado. COVID has disrupted the healthcare landscape beyond the direct impact of people who have been diagnosed or gotten sick from COVID. It's sad. It's disheartening. In 2020, 46,808 people died in Colorado, the most ever recorded in 1 year in the state, and a 21% increase over the average number of deaths for the 3 previous years. The percentage increase is indicative of a mass casualty event, the biggest 1-year spike in many decades and the largest since at least the 1918 pandemic. I think the closest analog would be the influenza pandemic back in the early 20th century, said Kirk Bohl, the manager of the state's Vital Statistics program. I don't believe we've seen anything to this magnitude in essentially the last century that would compare. And while it has been well known that COVID-19 has been hardest on seniors, The hidden toll beyond deaths caused directly by the disease is only now coming to light. Eileen Doherty, executive director of the Colorado Gerontological Society, which advocates for the state's elders, described the numbers as horrible. But given how hard the pandemic has hit the state's older population, I guess I'm surprised the increase in deaths is not higher, to be honest with you, she said. According to the state's own pandemic website, people over 80 account for 54% of the state's COVID-19 deaths, while making up just 3% of the population. Those between 70 and 79 represent 24% of the deaths, though they're 6% of the population. Death certificates from 2020 are still being counted and causes certified, meaning that the official totals don't yet match the more than 5,500 deaths from COVID-19 the state has identified from hospitals, physicians, and coroners. But it is already likely that the disease caused by the coronavirus will be the state's third leading cause of death last year, after malignant tumors and heart disease. What's there to live for? Why am I here? That's what one 86-year-old man living alone in Thornton, Colorado, recently told Jayla Sanchez Warren, who leads a regional agency on aging, as she tried to help him get vaccinated against COVID-19. He was struggling to get a vaccine and was frustrated. His wife had died, I think, 3 years ago. He didn't have family in the area, she said. He was feeling this malaise. She said his despair is a typical symptom of a failure to thrive, a term many experts in aging use to describe what they've been seeing a lot of this past year of the pandemic. Other symptoms include isolation, loneliness, and depression. That's often followed by a lack of desire or inability to eat or get nutritious food for yourself. And it appears, experts say, to be a factor in the sharp increase in the number of Coloradans who died in 2020 from nutritional deficiencies. It's just hard to overestimate the impact that COVID has at every level on facilities, on staff, on residents, on families, said Dr. Gregory Gamm, a geriatrician and chief medical officer for Vivage Senior Living, which operates about 40 long-term care and assisted living facilities in Colorado. It's been almost a year since we've really allowed people to come in and visit, he said. Due to strict rules aimed at limiting the spread of the virus, it's also been a year since those residents could eat together, often their main source of interaction and human contact. That isolation is just an enormous impact, Gamm said. In many facilities, he said, 20 to 25% of patients have either died or moved out since the start of the pandemic. And the coronavirus, in part due to stricter rules, has taken a toll on the ability to admit new patients. The stress of the pandemic has also hit staff members who are dealing with many more public health measures to keep themselves and the residents safe. That's not to mention seeing some residents die and worrying about picking up the virus themselves. All of these factors, he said, contribute to residents struggling. A lot of younger people might overeat to treat their depression, but for older folks, it's the opposite. Tend not to eat. You lose interest. You lose interest in everything, and you quit eating, Gamm said, noting the state's increase in deaths from nutritional deficiencies is one likely result. So I'm not surprised by that, he said. You isolate people month after month after month. You don't get to see your family. You don't get to come in and out of the facility with activities. People get depressed, Gamm said. Okay, I'm going to turn to my conversation for today. I've been really looking forward to this discussion. Let me introduce you to Deborah Carr. Deborah Carr is professor and chair of the sociology department at Boston University. She's written more than 100 articles and book chapters on topics related to aging, health, and stress. Her recent books include Worried Sick, How Stress Hurts Us and How to Bounce Back, and Golden Years, Social Inequalities in Later Life. She was editor-in-chief of the Journal of Gerontology, Social Sciences from 2015 to 2020, and her work has been featured in a number of media outlets, including the New York Times, NBC Nightly News, and USA Today. Deborah Carr, thanks for making time to join me on COVID Calls today.
Great. Well, thank you for inviting me. It's a pleasure to be here.
I'd like to start the way I generally do, which is just to find out where you're calling from and what the pandemic situation is looking like there today.
Sure. I am in Providence, Rhode Island, and the rates are kind of flattening. The rates of vaccination are going very well. And Rhode Island started what some consider slowly because it explicitly took kind of a social justice approach and first targeting those communities of greatest need and then scaling up. And completely unrelated to my work as a sociologist, I actually volunteer at the vaccine clinics doing paperwork and registering people. And it's just a full swath of the population, every age, every background. So I think things are going as well as can be expected. But of course, there are always a couple hiccups along the way with rates going up and down.
What's happening on campus?
Campus is very quiet. Maybe not today specifically, because today is a historic day of sorts in the United States, given the recent verdict, but it's very quiet. The students have the opportunity of taking classes live or remotely, but the vast majority have chosen to take remote classes, even if they're in their dorm. So I go to campus one day a week, but it feels very quiet. But we are tested once a week on campus, and we have a vaccination requirement for fall when the semester goes back. So the campus has been very, very responsive and very, very careful in how we bring students onto campus and the way we will be teaching in the fall.
It's interesting you mentioned being involved with the vaccination effort. I was talking with the writer John Mualem last week, and he described the same thing, but way out on the West Coast in Washington. And I wonder, could you say a little bit about what it's meant to you to be involved with that?
Yeah, it's been really meaningful. And I should say again, my partner works in healthcare, so he actually can vaccinate them. And so he started doing the physical vaccinations, but then there's a real need for those on the administrative side and those who can use computers, who can work quickly, do inventory. And it's been really interesting because of how it's been done. So lately, it's been the mass vaccination clinics where I've been volunteering, where they have anywhere, up to 1,500 a day coming in, to other ones that we've done that we bring the vaccines to nursing homes, right? To group homes for young people with spectrum disorders, for instance, to low income housing development. And that for me as a sociologist who studies aging and inequality is particularly meaningful because on the ground, I can see how it's done, right? Sometimes these nursing homes are crowded. Sometimes the apartment complexes that are subsidized are crowded and not the most pristine environment, but still the folks working on site there are so committed to working with these communities, and they're really well organized rollouts that people will come down on time. If they forget their card, we send them back up to get their card. And so it's just kind of this combination of social justice, community spirit, and gratitude. People leave so grateful when they finally have their vaccines, and especially that second shot when they feel they can re-engage with the world again. So it actually is a bit emotional, even though I'm just kind of sitting there with a PrepMod device, getting people checked in.
Thank you for that insight and that description, and just sort of building on the article I was reading earlier about what's going on in Colorado. These mass vaccination moments may be some of the first times that seniors would have been together, I think, maybe in some of these larger groups over this past year.
They absolutely are, because people, they cannot spend time with one another. Some barely leave the building, right? Because they can't go out into the world. And so after we give the vaccines, people have to sit for 15 minutes, as you may know, or they have to sit for 30 minutes if they have some condition. And we space out the chairs so everybody's 6 feet apart. But people weren't leaving at 15 minutes or 30 minutes. They were sitting in their chairs for 45 minutes, just talking and sharing recipes and having kind of this grand old time in these properly spaced chairs after they got their shot, because it was an opportunity for them to re-engage with members of their community. So it was something that was kind of a little bit surprising. And we couldn't give them snacks, obviously, because you take off your mask, and we couldn't do that in the public setting, but they just really were thrilled to see each other. And so that was kind of a surprising thing, that we actually had to get people out of the waiting chairs so that we could bring in the next batch of those who had been newly vaccinated.
Wow, that's a time to move on, clear the chair, because
exactly.
We've got this
come on, your 50 minutes is up. We thought they would be out of there in 12, but no, people were sitting and kind of schmoozing through the duration.
I've talked to guests nearly every day whose research is relevant to some aspect of what we've dealt with in this pandemic. I can't think of anybody I've spoken to before you whose work is as important, as relevant as what we've seen in this last year. The impact on seniors and aging populations, not only in the United States, but around the world has been, I mean, heartbreaking doesn't really capture it, infuriating, and so many questions. And so I want to just start. We can start anywhere you want, but one thing I'd like to start with is your book, Golden Years, and I should say it's Golden Years ? Golden Years: Social Inequalities in Later Life, which received the Kalish Innovative Publication Award from the Gerontological Society of America last year. Quite a year to win that award. Yeah. I wonder if you could tell us about some of the findings in that book, anywhere you'd like to start, but I mean, so much of it is necessary for helping us to understand this broader impact for what seniors dealt with last year.
Yeah,
and this
absolutely.
year.
And again, Truth in Advertising, I wrote that book before COVID. And I'm writing kind of another book now on the demography of aging. And I am writing it entirely differently because of COVID. The world has changed so much. But I think some of the key themes of Golden Years are just as relevant, or even more so in the COVID era. And the theme of the book is that even though prior to COVID, there was this public perception that the older years were golden, right? If we turn on our television, we see prescription medication ads where white, attractive older adults are on their yachts and they're playing golf and they're frolicking with their new prescription medication. And there's also kind of public outcry, again, about national resources, right? If older adults indeed have a 10% poverty rate, and the poverty rate of children is 15%, for instance, if we have rising child poverty rates, why are we continuing to give Social Security and Medicare to older adults, right? There's been this question about why are we giving resources to older adults? Many people have seen kind of the greedy geezers memes, the boomers, they're robbing our future from the millennials. And I thought that portrayal of older adults really missed the boat, and it was overly nuanced. So overall, yes, 10% of older adults live beneath the federal poverty line in the United States. And if we look at white married older adults, especially white married men, it's about 3%. But when we look at women of color, if we look at women of color who are unmarried, the poverty rate is as high as 30 or 40%. And that is devastating. And so the argument in the book is that we can't just look at older adults as this monolithic population, but we really need to understand that some face much greater economic adversity than others, much greater physical adversity relative to others. And so that's why there is a question mark after the years, Golden Years in the book title. And those themes, that inequality is persistent in later life. Another argument I make is that these inequalities don't magically come across on someone's 65th birthday. They are the end product of accumulating inequalities going back to adulthood and adolescence and early childhood. And all of those themes are coming true in COVID. It's not all older adults. It's those who are lower income. Persons of color of any age have far greater rates of COVID than their white counterparts. So I think this whole notion of intersectionality, and that we sit in multiple categories, an age group, a gender group, a race or ethnic group, all of those things can either open up our possibilities for health, wealth, and happiness, or foreclose it, given these structural obstacles.
Just a couple of notes, maybe you can help set the stage a little bit. So when we're talking about older adults, are we talking about 65? I mean, is that a set research category? It's 65 years and up? Or is there some gray area around what we mean in our terminology there?
Yeah, that is actually a surprisingly profound question. Technically, most research in the United States, and actually most other places, uses 65 as the demographic cut point for old age. So when we talk about older adults, it tends to be 65 plus, just as our demographic category. But there is a real strong recognition that people age at different paces, right? If you're a professor, you're sitting in a chair all day, we have actually quite lovely lives. We are not inhaling toxic chemicals on the job. We live in safe neighborhoods. And so there's a lot of research showing that biological aging actually is sped up for people who have faced more economic, social, and environmental adversities. So the body of a 40-year-old homeless person could be comparable to a 70-year-old white-collar worker. And that's part of the reason why we're seeing higher rates of COVID at younger ages among those who come from lower income backgrounds and from ethnic and racial communities that have faced systemic racism.
Well, thank you for that. I mean, that's a really interesting point to make. And also, just a little bit about sort of conceptions of old age. So, I mean, we have that 65 as a threshold in terms of the way the government looks at things. But retirement age and the actual age at which people retire is those are not perfectly aligned. I mean, I think of my grandfather, both of my grandfathers. My mother's father and my father's father. I have other grandfathers since they divorced and remarried. So I have four grandfathers, actually, I should say, but all of them actually lived significantly longer than their retirement age.
Yeah.
And so they were, greatest generation, men who were primary breadwinners in their family. So that sort of comports with what you might expect demographically for white men of that era, and they all retired on time, and then they lived a long time after that. And so some of our notions of what aging means and how that connects to age 65 and sort of the life course, it didn't seem to fit what they thought their old age was going to be like. And so to come back to your term, golden years, I mean, those golden years, I think for them, they thought would be maybe 5 years.
Mm-hmm. Yeah.
So I wonder if you could say a little bit just about how those expectations have been shifting and how that might factor into some of these things you're talking about.
Yeah, that's a fantastic question. Retirement has absolutely changed and has again become this kind of stratified experience. And, back in the old days of your grandparents or my grandparents, there was forced retirement, right? Some workplaces would politely push a worker out the door at age 65. Today, very few industries have forced retirement. Airline is one. They have certain restrictions for airline pilots of a certain age, for instance. So people aren't being quite pushed out the door anymore. Each generation can kind of collect their full Social Security at slightly older ages because there's a recognition that for many people, 65, you're still healthy and vital, and you don't need to retire and then be sitting in retirement for 20, 25 years, right, with no gainful activity. So, for my generation, probably yours, because we're probably around the same age, it's age 67, for instance, that we can collect our full benefits. So that's just a little bit about kind of the legal benefit side with changes in Social Security. But there's this really interesting paradox with Social Security today. It's that those people who have enough money in the bank that they can retire at 65, they don't need to work, they have enough savings. Those are precisely the people who hold jobs that are designed for aging bodies, like professors and lawyers and bankers. Many of us could afford probably, maybe, to retire at 65 and then have enough money to sustain us for the long haul. But we keep working often because we like our work. At the other end of the spectrum, we have blue collar workers, right? Waiters, waitresses, those working in grocery stores, those working in warehouses, who can't necessarily afford to retire the day they turn 65 or 62, yet at the same time, their jobs are not designed for aging bodies, right? And so we're seeing this kind of real difficult situation for those who work in physical labor jobs, maybe who don't have the savings, and their jobs don't necessarily provide them the private pensions, right? Academics, and professionals have things like TIAA craft. So we actually have pensions. But generally speaking, the more physically arduous and low paying your job, the less likely you are to even get a private pension. So those least physically equipped to work long periods are the ones who are forced to do so because they don't have the wherewithal to sustain themselves through what could be a very long retirement.
Just to follow up a little bit more about some of your findings in the book, how important are social networks to senior citizens?
They're very important. And, we've been talking a lot about kind of the economics so far, but the importance of social networks just cannot be understated. And social ties, and, the word social network is kind of jargony, right? We use it, but it basically means your friends, your family, but even these more distal ties, your neighbors, the business people you see, your hairdresser, your barber, because one, they provide emotional uplift, but also their eyes and ears on older adults. It can make sure that someone's coming in regularly for their haircut, making sure that they come in without bruises on their arms, because we know that abuse has actually picked up during the pandemic. But those networks are so important, so much so that in the UK, the United Kingdom, you might know that a couple of years ago, they appointed their first national minister of loneliness, right? A government official charged with making sure that people had friendship ties, and if not friendship ties, visitors coming by, because loneliness or lack of ties is linked with elevated risk of pretty much every cause of death and depression and anxiety. So being alone has real physical and emotional costs for older adults.
You touched on this a little bit earlier, but maybe you could say a bit more about the differential experiences along gender lines for older adults as well.
Yeah, there's so many. And in terms of social relationships, it's very interesting that social ties for men and women actually can be good and bad. You know, most women tend to have, especially older women, have more networks and more people they can rely on for a bunch of reasons. But one is women are considered the kin keeper. That's the term that anthropologists use, that women are the ones who arrange the parties and the dinners. And so oftentimes after their husband dies, they still have their female friends. They have close ties with their children and their nieces and nephews. So women are actually really quite well integrated in ways that men aren't. I mean, men in heterosexual unions tend to rely almost wholly on their wife as their lifeline. The wife is the one who calls the kids and then puts dad on the phone. So, right, we all have seen this often in our own lives. So when the wife dies, husbands often have very few ties, or it's harder for them to re-engage. So we have those different patterns that women are generally have larger networks and closer and warmer networks, a broader base than husbands. But the downside of that is women often have more people to whom they have to give care. And so that can be very draining. In low-income communities, those older women are sometimes taking in grandchildren and caring for them when their own children cannot. So relationships on the whole are a really great thing, but sometimes they can be a drain on older adults, and especially older women's time and energy and emotional energy.
Let's bring in another one of those intersectional points and talk a bit about what you've discovered in terms of race.
Mm-hmm. Yeah, for race in general, you know, these are broad, generalities, but older adults who are Black and Latino generally report more extensive and closer family ties and more fictive kin, again, which is a term for those people who are like family, even if they're not biologically related. You know, it could be a best friend, it could be a member of one's church community, for instance, these larger networks. So there often is a very high level of social support and engagement. And you see the data on the younger side as well, that kind of adult children who are Black and Latinx actually report more so than whites, feeling this sense of kind of commitment or obligation to care for mom or dad or grandma or grandpa. So there is a very rich social support. But with that, again, comes social obligations. So one of the most rapidly growing family categories over the past 20 or 30 years has been what we call custodial grandparent. So it's usually a grandma who becomes the full-time caregiver to a grandchild. And usually it's precipitated by something difficult in the family. The child's parent, meaning the older adult's son or daughter, might be incarcerated. They might have died prematurely. They might have addiction problems or financial problems. So already a stressful situation that often comes out of economic and racial injustice. So here you have an older adult coping with whatever problems beset their child, and now being the full-time parent to a young child who often has a lot of energy, who might bring home germs from school, because we all know that's what kids do. And if, you know, your kid comes home with a cold and you're a 30-year-old mom, that's one thing. The grandchild comes home with a cold and you're a 70-year-old grandma with a declining immune function, it's something quite different. So again, that intersectionality of race and gender and class all can create just a series of challenges for some older adults.
But just to make a note, these are all findings that you wrote up and published in your book, which came out in 2019, Golden Years, Social Inequalities in Later Life. Just to sort of pause at that moment, what were some of the policy implications, do you think, of this work, or even specific policies that you advocated as a result of this work?
Yeah, good question. And I should say, even though I summarize all of these findings in my book, many of them were discovered by other researchers. So shout out to the many researchers whose work is cited. I talk a lot about policy in the final chapter of the book. And one thing I try to make really clear is that it's not just old age policies that we need to remedy these problems.
Mhm.
We need, of course, Social Security. We need to maintain Social Security and ensure that those living in the lowest economic strata have benefits and bring them up above the poverty line, right? We need Medicare. We need insurance for older adults of low income, but that's not enough, right? We need policies going back to early childhood, right? Things like Head Start that help all children to get a start in life that allows them to have the education and economic resources that will help them to grow old under conditions of comfort. So I talk a lot about policies that bear on the lives of younger people, whether it's food stamp or SNAP programs or early childhood interventions. I think that's something that's really important. The other are more effective family leave programs. In the United States, we have the Family and Medical Leave Act, which applies to only a relatively small sliver of all workers, right? Those who work in larger companies. And so whatever we can do to help caregivers, right? Both kind of adults who are caring for their aging parents, but as well some supports for these aging adults who might be caring for dying spouses or for children or for grandchildren. So I think it's important that when we think about old age policies, we recognize that the generations are all intertwined and that old age, the way we turn out at 65, again, doesn't happen on our 65th birthday, but rather is the end product of the accumulation of inequalities that date back to birth and some even argue in utero.
I just want to follow up on that quickly. I mean, it's such an important point. I'm learning so much just talking with you today. But the way we advocate for policy in the United States is often around age groups. I mean, and often very tightly drawn sort of identity groups, and identity politics in the United States sort of drives a lot of these kind of things. So I think of the American Association for Retired Persons, people, AARP, make sure I get that right.
That's correct, yes.
One of the most important lobbying organizations in the United States. Is their approach in line with what you're describing here? So they're not just advocating policies for people who are 65 and up, but actually for policies that affect people over the life course so that when they do reach that older age, it's healthier.
Yeah, I think so. I think largely their mission is, again, older adults, but all of their materials emphasize things like caregiving, right?
Mm-hmm.
They recognize that older adults' lives are intertwined with the generations that come after them. And I think it's just strategic to think about aging policies is just embedded in these multi-generational ties, because once we get into like the generation wars, millennials saying, oh, don't help the boomers, and the boomers saying, oh, the millennials aren't, picking themselves up by their bootstraps. That kind of generational tension is nonsense, because none of us is an individual who is free floating out there, completely divorced from other family members or other generations. We're all interconnected. And any policy or intervention that helps one generation will necessarily help the generation above or below, right? If we have policies to help a 20-year-old or a 30-year-old get rid of their educational debt, what does that mean? It means that their aging parent doesn't pick up that educational debt, as we know happens. We know that for a lot of midlife adults, they are just strapped by their kids' educational debt. So that's a theme I have throughout, that something that helps one generation will necessarily help the members of their family network.
I just want to remind folks that you're listening to COVID Calls, and I'm talking with Deborah Carr today about aging populations and COVID. And we've been getting a sort of a background of things we needed to know before 2020 happened. So walk us through that year a little bit from your perspective. And I guess my first question with this is, it doesn't sound like anything that we saw would have been surprising to you last year based on the research that you were just describing, but maybe you can say a little bit more about some of the nuances of what you were tracking over the year and how that fit into the research you'd already done about the challenges older populations face.
Yeah, I mean, I wouldn't be so arrogant to say none of it surprised me, right? I think the disparities aren't surprising, right? The fact that lower income communities, those working in frontline jobs, certified nursing assistants, again, those jobs that have a very high level of engagement with the community, it wasn't surprising that their rates were so much higher. Just the travesties of the nursing homes were the imagery was surprising just in the magnitude of the suffering, right? But I think those of us who study aging have kind of known that older adults, and not all older adults, not a 65-year-old, but once people really get to the advanced ages, or 75 or 85, like you said at the beginning of the show, those are the older adults who are the most physically vulnerable, right? Because that's when they really start to have these declines in immune function, and they start to have the onset or presence of other conditions that render them more vulnerable to the virus. Also, another thing that the base wasn't surprising, but just the magnitude of the problem is just the problems with nursing homes, right? Nursing homes have struggled for a really long time. They've had labor shortages for a really long time because they're low-paying jobs, right? They rely heavily on women of color, for instance. So the shortage of workers in nursing homes has been around actually for a long time. Some of it is key to how they are funded, right? Through public supports. But I think just the magnitude of the spread in nursing homes, I thought was just devastating to watch. The magnitude of suffering of those who work with older adults. And when you look at it logically, of course, they're in congregate care settings. The illness will spread from room to room. If you have a low-paid CNA going to one nursing home and then giving private care elsewhere in the community, they may bring the virus in. So once you start to take it apart, it wasn't surprising, but I think every single one of us was just moved by the magnitude of the suffering that we saw. And then the second tier was the efforts to contain the virus led to this whole new form of suffering, right? Was it a good idea to shut off all visitors? There've been a lot of debates about that, but the social suffering and the isolation was horrible for the older adults and the family members who lost them, who could not have those final moments together and who could not say goodbye in person and had to do so, again, through windows of nursing homes and through iPhones, that the nursing aides were holding up to the dying patients' faces.
I mean, just to follow up with kind of an obvious question, but couldn't nursing homes and shouldn't nursing homes management have thought about maybe not a pandemic of this scale, but events that would strike that would be of this type? And it didn't necessarily have to be a public health event. It could be earthquake or other kinds of disasters that would make similar kind of conditions come into place for a long period of time, in which they would need to overcome some of these problems. They would need to make it so that relatives could visit safely from a distance, or any of these other things that they seem to literally be discovering in the moment.
Yeah, and that's a great question. I don't have an answer because I don't know what the nursing home directors were thinking. I mean, I know the infectious disease experts for years have been saying it's a question of when, not if, we have another pandemic of some sort. I think maybe because so many of the other pandemics happened in other places, right? In the United States in particular, we sometimes think if something's happening overseas, it may not bear on us, this kind of localized thinking. But you're right, there have been other disasters, right? When there have been heat waves, right? There was that tragedy in Florida, about 2 or 3, probably 3 to 4 years ago now. If a generator goes, for instance, and the AC goes, there have been other tragedies like this. And I actually don't have a good answer as to why there haven't been these kind of emergency plans in place that could be executed, other than just kind of wishful thinking. And again, coming back to that theme of lack of staffing, because they all struggle with high turnover and lack of kind of long-term staff members who maybe have that institutional memory to help build and sustain some of these safety programs.
Is that that lack of staffing? Other guests I've had on COVID calls have pointed to that as well. Is that a function of just those being low-paying jobs, or there's something else about that kind of work that leads to that really rapid turnover in those settings?
Yeah, I think it's largely not only the low pay, but kind of the lack of a mobility ladder. I think that's part of it. The other is it is physically draining work, right? It's physically hard, kind of often lifting bodies. Many who do hold those jobs, I mean, they care deeply. I mean, I've also volunteered at nursing homes at the beginning of the pandemic, kind of sitting with dying people. And you'll see these young CNAs working so hard, not only to deliver direct care, but sitting there for hours, holding the hands of dying people in their final day, again, holding up the iPhone. And so it's not that these workers don't care. It's not a claim at all about the workers, but rather it's really physically hard work. I think that's part of it.
One of the discourses we heard early on in the pandemic, and it's a very unfortunate one, and it was a sort of it was like almost a eugenicist sort of argument that, this was going to impact older people. This came out of, I think, the lieutenant governor of Texas went on TV and said this, that, the older generation just needs to make a sacrifice. And he sort of said, they're the greatest generation, they can sacrifice. And so in a sense, the implication is if older people are the ones who are dying in society, we don't have as much to worry about because, hey, they've already, their best lives are behind them, best years of their lives are behind them. I mean, as a person who was very close to grandparents as a child, I found that, offensive doesn't even capture it. I was just mortified that a statement like that would be thought, not to mention become part of our political discourse. And yeah. I guess it's not even really a question for you. It's just something that struck me last year. And I wonder how you reacted to that.
Exactly the same as you did, kind of horrified. This notion like, oh, heck, they've been around long enough. And memes, you've seen these memes go around, like calling COVID the boomer remover. I mean, it's disgraceful. And if you applied the label like remover to any other group other than older adults, it would be horrifying. It would be eugenist, right? So yeah, I think it was absolutely appalling and feeds into, again, these generational divides that fail to recognize that we are all interconnected. There's been a lot of writing. You mentioned earlier, I edited a journal for a long time, and we got so many papers over the past few months about ageism, how ageism has spiked during the pandemic. It's either the beliefs or all these old people are spreading the disease. We have to shut down our restaurants and bars and graduations because of the old people. And it was just wrongheaded, right? Older adults are more likely to die of COVID if they contract it, right? Because of, again, declining immune function. But every single age group has contracted COVID. And young people also spread COVID by being young and not masking appropriately. So scapegoating older adults, I think, was just awful for them. It was wrongheaded politically, and it perpetuated the notion that old age equals death. And again, like we talked about earlier, 65, 70, you're pretty young and healthy. Heck, our president was elected at age 73. There are examples, Rubinstein gave his first piano recital at, this great recital at age 88, for instance, right? We see on a daily basis people making political and economic and cultural and family contributions far beyond their 65th birthday. So this notion, oh, hell, let them die so we can reopen our bars and restaurants is callous, to put it at the very least.
Do you see much evidence that social ties might have strengthened during the pandemic in some ways for older adults? And I'm thinking here, again, it's just a personal example, but checking in on family members who may be distant from you. So it's not missing a visit to the nursing home. This is more just like calling your retired parents to check in on them, or vice versa. I know for me, that certainly increased throughout the year. Now that's a tie that already exists, but maybe it's possible that there's been a sort of new form of networking that's emerged throughout the pandemic. I wonder what you think about that.
I think there has been, and I think it's new, and it's kind of a new form. It's redirected, bringing mom and dad or grandma or grandpa to Zoom. And, some older adults are not necessarily comfortable with computers, but once they get on, you do hear, having group meetings, right? Multi-generational families all on Zoom. Older adults who maybe couldn't have left their house earlier, attending religious services via Zoom, or even doing exercise classes in their chairs, having college and high school reunions through Zoom, keeping up with grandkids who maybe wouldn't have been calling them so much earlier, who are now on the computer, seeing new babies across, the miles through Zoom. So I actually think, even though a lot of us grouse about having to do everything virtually, it really opened new possibilities for many older adults. So I think there actually has been a fair amount of good that has come out in terms of integration and learning. But that's for people who already are socially networked, right? For those who are alone, it has been a difficult road to toe because they might not have someone to show them how to use Zoom. One population that has it especially hard are kind of rural older adults or those who have weak internet connectivity. They have kind of no way of engaging in some of these programs of support that more well-off or well-connected older adults have.
That's interesting because that means it's going to potentially sharpen that inequality among
Absolutely.
seniors. Just to go back to the first part of that, what the answer you gave, I think that's really interesting because it pushes back on, the idea that once people reach a certain age, they can't adopt new patterns in life. They can't adopt new technologies, whatever it is. It seems pretty clear that's just not true.
Yeah. And if they have the technology and they're willing to learn, they can. I mean, a lot are nervous about it, but once they're kind of walked through, or if on Zoom, you can put captions on Zoom, that makes it a little bit easier for those who might have some hearing impairment. So for those who have the supports to learn or who live in a community actually where there are volunteer services, they are being kept engaged fairly well.
Just one question that's been on my mind about the larger impact of the pandemic, thinking forward a little bit. I wonder how you think people who are considering leaving their homes and moving into other kinds of care facilities. It's a group home, maybe not a nursing home, but somewhere in between, a sort of assisted living or some variant of that. And there's so many versions of that kind of living arrangement out there today. But I wonder, do you think that people will pause and really think much harder now about whether or not they want to move into these kind of congregate settings based on what we've seen in this last year?
Yeah, I think they will. And I think because it gives some types of long-term care settings kind of a bad name. I think those kind of, 55 plus housing or places like the villages where people actually have their own unit and they have space, I don't expect that those will change dramatically. But I think those that where people live in close proximity might diminish in popularity.
Just a quick reminder that you're listening to COVID Calls, and I'm talking with Deborah Carr today about older populations and the impact of the pandemic. I want to, Deborah, just come to another one of your books, and we can talk a little bit more generally now about stress. This book is called Worried Sick: How Stress Hurts Us and How to Bounce Back. So this is another aspect of your research, and I wonder if you could just talk about that a little bit, about how this work helps us understand this is not just age segregated in this sense, stress more generally, but how should we be thinking about the stress of living through a pandemic?
Yeah. I think everybody experiences stress in some way, shape, or form. And I think, the important thing is that people find the coping techniques that work for them. They find the resources that work well for them. But everybody experiences some stress, and especially in a pandemic. In the stress world, we talk about kind of the primary stressor and then the secondary stressor. So the primary stressor is like the main thing, like COVID. It stresses people out. We worry about getting it. We're giving it to our family members. But secondary stressors then lead to this whole trickling of new stressors that are different for different people. For some, it's blending work, family, and homeschooling. For other, it's their job loss and the financial strains that entails. In some cases, an empty nest couple finds that their child is coming home from college or coming home from their new apartment in New York because they're afraid to be in the city. And so there were so many new experiences that were triggered by COVID that people just had a multitude of stressors. And that's all against this larger backdrop of kind of political and social unrest. I think for families of color, seeing just systemic racism in the worst possible form over the last couple of years. And so there have been kind of these pressure cookers of stress that have been different for different communities. But I don't think there is a single person in the US or perhaps worldwide who has not experienced some additional strain or emotional wear and tear surrounding the pandemic and then the larger political, social, and economic climate.
I have so many questions about this. So how do you differentiate or understand sort of chronic stressors? So things people have a long-term health condition, or they have a long-term difficult work situation. It could be in any number of ways. And how do you think about that in relation to stressors that pop up unexpectedly, like all of a sudden now I can't leave my house because there's a global pandemic going on?
Yeah, that's a great question. The two are often very intertwined. So sometimes there's like a chronic stressor, like a pandemic strikes, you lose your job, but then that often leads into those chronic stressors like financial strain or social isolation. In general, the event kind of stressors really kind of do a number on us on the short term in terms of things like elevated heart rate and poor sleeping and self-medicating through things like alcohol or cigarettes or drugs that actually make things worse. But over time, kind of that initial impact tends to minimize a bit for many people. Chronic strains are hard because they're there all the time. And so unless someone can really adapt or figure out a way or obtain resources to help them manage it, it's something that they're day in and day out. And so most of the data do show it's chronic strains are the ones that take a toll on all of our systems, right? Cardiovascular, cardiopulmonary, and certainly our mental health, because there's almost no escaping it.
Is there a sort of I don't know, a standard quantification model for stress, something that we can actually use to compare? I'm a historian, so I get very nervous about such things. But I mean, it is the kind of thing that if you wanted to be able to say ahead of time, there's chronic stress, this is where a person is on that scale, and then that would help direct resources in the middle of a disaster more effectively, I would think.
Yeah, that's a great question. Most of the measures, admittedly, are subjective. And that's kind of a blessing and a curse, right? But if someone perceives something to be so, it's real and it's consequences. I mean, that's how social scientists kind of perceive their work. I mean, event stressors are very easy to measure. Did you have a death in the family? Did you lose your job or have an income decline in the past 6 months? So those are kind of factual indicators. But another way to get at stress is something like, how frequently do you fight with your spouse? How frequently does your job drain your energy? So there are perceptions of how frequent, or also perceptions of how intense. How much do you feel stressed by your marriage? How much does your job worry you? So oftentimes we measure it in terms of kind of how often or how intense it is. And again, they are perceptions. But these measures are pretty tried and true because they're all kind of statistical tricks people can do to kind of figure out things like measurement error. But most of the measures are considered pretty good. And there's always some people who rate everything as very, very stressful. But one way we get around that is we control sometimes statistically for something like negative affect, like a neuroticism measure, whereby some people think everything is very troubling all the time. Others are more able to kind of roll with the punches. And so there are ways you can kind of statistically tease that out with appropriate measures and models.
Do you have a very good understanding of how stress, event-driven stress, might have longer-term implications that we might not understand so clearly? And I'm thinking here of post-traumatic stress, which a lot of times with disaster victims, people who live through war, people who even sometimes it can be much later. This came up recently around Fukushima. We had the 10th anniversary of Fukushima, and some people only just now feeling that they can speak about that event 10 years later. I wonder how you sort of make sense of what can be a time interval in which people are suffering throughout, but we don't hear about that stress till later.
Yeah, that's a great question. There are some stressors that only kind of hurt people when some time has passed, and maybe they're reacting physically to it. Maybe they're experiencing things like elevated heart rate, for instance, but they aren't reporting it yet as distressing, maybe because they've kind of pushed it down too deep. But you do often hear that people will not talk about a major stressor, whether it's veterans from World War II, certainly victims of sexual assault and sexual abuse. They don't talk about it when they're going through it, either because it's too traumatizing or because it's just such a kind of a world-altering stressor that they feel they don't even have the vocabulary to share it yet. Or in many times they worry that if they share it, they will be kind of victimized yet again, that they may be judged somehow, for instance, or they won't receive the support they want or need. So sometimes you're right that these reports of distress or the symptoms might not come out until quite a bit down the road. And our research isn't as good with those type of events because it's statistically more rare. We have much more research on how people cope with job stress or financial stress because they're so common, and we are less good at getting at some of these statistically rare but still incredibly powerful stressors and traumas that people can go through.
This has been on my mind a lot throughout the pandemic because, you know, we rely on statistics like how many people died.
Yes.
Or what's the infection rate. But a disaster of this magnitude, well, any disaster, I should say, but certainly one of this magnitude, it has so many unmeasurables or difficult to measure aspects to it. And it strikes me that stress is going to be one of these key ones. I'm worried that we're going to have significant impacts that people don't even know how to make sense of yet because they've learned to cope in this time. But that stress is going to lead to longer term impacts that we don't have good ways to even think about at this point.
Yeah, absolutely. And I think that's one of these new projects that I'm working on actually with Ashton Verdery and some other bereavement researchers. We're trying to figure out a way, can we get some kind of national record of things like even multiple bereavements, right? It's pretty rare that someone loses multiple family members. And we know that one early death, for instance, of mom or dad, for instance, can have long-term ramifications in some cases for mental health, but often just for one's life trajectory, whether one completes schooling, for instance, whether one goes on and has kind of a solid work life, for instance. And imagine your child living in a community, an urban community with very high rates of COVID, who might lose grandma and an uncle and a sibling. What is the long-term impact? I think we can speculate that it would be devastating when one's whole community has been devastated and maybe cannot offer supports. That you're right, we don't have appropriate data yet. And I think it's incumbent on all of us, and again, the policymakers who support science and all of our nations, to help us get that data in real time so we really can understand what the future may be like.
This is like absolutely like life-saving social science as far as I'm concerned, what you're talking about here. Just in the near term, I wonder what kind of, again, thinking about policy a little bit, what should policy makers be doing to address stress? I mean, what kinds of new policies, kinds of supports? I suppose money is always one form of answer, but it has to be spent in the right way to address these sort of accumulating stress impacts of the pandemic.
Yeah, absolutely. I think kind of economic ones are always important. Anything having to do with caregiving or family leave. We know that women have had a major hit to their work lives. So support for caregivers who are either homeschooling or caring for aging parents or for dying spouses, any kind of caregiving supports are important. But something a group of us are working on now is kind of bereavement policy. We don't have a national bereavement policy in the United States. We have very little in the way of supports, even for the basic funeral services that people might want to commemorate their loved one. Things like bereavement leave from work is something that there's no consistent policy on. Again, long-term supports. We think about the emotional aspects of bereavement, which is clearly something that's profound. But let's say you're an older person who loses the adult child who the one is caring for you, or you're a child who loses the parent who supports you financially. Right? We tend not to think about bereavement. We just think about it in terms of sorrow and sadness, which absolutely is important. People are suffering. But these larger economic factors and social factors that can kind of undermine a family's cohesiveness in the long term isn't something that we often think about. But we often haven't had kind of mass death like this in the United States, and every community has been touched in some way.
I guess we have to go back we're talking about multiple bereavement. So a person might have experienced near-term death of several members of their family or close social ties. I don't know how far we have to go back to find something like that. I mean, World War II, I suppose, maybe the Great Depression. It's a while back. It's not in recent cultural memory, is it?
No, not in my memory, at least not in in the United States. There might be some parts of the world that have had warfare, for instance, right? So traumas in other parts of the world, some natural disasters, 9/11, if you're from the New York area, that was, again, very, very powerful. But really not since, the epidemic of 1918, right, have every possible strata at every part of the country, right? Kind of natural disasters are very localized and they're traumatizing for that local area. But in terms of something of national scope, no, not since like a major war or which for many of us is not our recent memory.
Kind of a research question for you, but how useful are comparative studies there? I mean, for example, we could look to Southeast Asia in the 1960s, so recent 1960s to 1980s, to find those kind of cases where people certainly would have had multiple bereavement, or more recently in Iraq or Afghanistan, we could find those proxies. What would be the limitations of doing that kind of work?
Yeah, that's a great question. I think there are absolutely lessons that we could learn there in terms of, again, emotional responses. What kind of supports do people find most protective or not protective? But I suspect there are also cultural differences. And the United States and a lot of kind of wealthy capitalist nations have this very much, again, pull yourself up by your bootstraps. We tend not to be community oriented. We tend to focus on our own inner strength and coping. So I think there would clearly be lessons learned from other communities, but we might also find that the coping tactics or resources that are present in one culture or society may not necessarily translate into this. But what I do think a major lesson is that we could glean from any of those other countries is this question: how do you cope with a major stressor when the very people who you would rely on otherwise also are undergoing the stressor, right?
Mm-hmm.
Oftentimes we'll think, oh, someone's going through a divorce, for instance. Well, they can rely on their friends and peers. But imagine you're in a community where you lose your spouse or partner from COVID, your best friend does, and everybody in your community lost someone and they lost a job. Your support network might lack the physical or emotional wherewithal to give that support because they're also suffering. And I think that's what makes the COVID moment so different. And again, this concentration of grief and stress is much more so in some communities rather than others, right? Bringing it back up to the, what we talked about in terms of nursing home communities and then low-income communities.
Almost up on time here with Deborah Carr, but I just wanted to ask you, you have such a rich set of research projects underway, and I can only imagine that COVID is now, there aren't enough hours in the day, plus you're department chair.
I am. Department chair ends in about 70 days.
So what's the next thing or next couple of things on your research agenda here as you go? I don't want to start using post-COVID because we're not even there yet, but as we move into this next phase of the pandemic.
Yeah, there are a bunch of new projects I'm looking forward to launching. The two that I think that are most germane, that I have my head in the most now, one is working with this team of bereavement researchers to try to come up with some national data, really nationally representative data in the US, where we all are, to find out how frequently are people bereaved of a close family member and of what causes, right? And what are the long-term impacts of having these multiple losses? Does it shape their adjustment and their attitudes? We're really trying to get those statistical snapshots because we think only when we have good data about how people cope with loss can we then have good interventions and good policy. So that's one project that we're in the thick of, and we're trying to get support so we can find a platform for doing a nationally representative survey. So there's that. Then with another project that's mostly related, with a team of BU researchers, we're trying to launch a project on flourishing, ideally, hopefully with the support of the Templeton Foundation. And this notion of flourishing or doing well psychologically has been studied in well-off communities. And we're asking, how do people flourish and find joy or happiness or optimism when they are living under conditions of extreme adversity? It could be communities with multiple bereavement, which is one of my interests. It could be people who are incarcerated, those grappling with their own chronic illness, and then also kind of geopolitical consequences of communities that are refugees, for instance. And what community resources and policies might people draw on, not just to survive, basically to get by and to sidestep things like depression and anxiety, but to actually have a rewarding emotional and social life with members of their community.
Just a reminder, you've been listening to COVID Calls, and you can catch COVID Calls most weekdays at 5:30 p.m. Eastern Time. Please join me tomorrow at 5:30 p.m. Eastern Time. We'll be talking about disability justice and COVID-19 with Lakshmi Fjord, Elaine Gerber, and Lenore Manderson. That's going to be a great conversation. And just thanking my guest today, Deborah Carr, for this discussion about aging populations and stress and COVID-19. Deborah, you're such a great advocate for the power of this research, and I wish you the best of luck with the next phase of the work, and I hope you'll come back and talk to us again in a few months and update us on your new findings.
Oh, I'm happy to. Great, and thank you so much for talking. I very much enjoyed this conversation.
Stay healthy, everyone. We'll see you tomorrow, 5:30 p.m.
Great, thank you.